Hello, my name is Sandra Fender. I'm the adult admissions tutor. Sorry I can't be with you in person, but I do hope that you enjoyed the presentation I put together for you and hopefully look forward to seeing you again in the future. Thank you.
We have a great reputation at Cardiff Nursing. Our rankings speak for themselves, a fact we are very proud of. Before making an application to us, it is really important to know if this is the right course for you and indeed the right career choice. Surprisingly, not all applicants understand what a nurse does or where they work. Hopefully, this presentation will help you decide. Adult nurses care for patients in a variety of settings and all stages of life, from 18 to elderly care and, importantly, to a dignified death. A key component of our role is that of health promotion and encouraging self-care, which is achieved by empowering our patients with their own skills and knowledge. This means we become educators as well as clinicians. However, when the need arises, we provide acute and long-term care where patients require intervention and support. Adult nurses work in a variety of care settings, from the most obvious hospital care, but also in community settings such as clinics, GP surgeries, patients' own homes with the support of district nursing services, as well as care and residential homes. Many nurses also work in the less conventional places, like cruise ships or even scenes of conflict. So how do nurses provide care? First of all, it is important to remember all care should be patient-centred, to include family, carers and loved ones. Care should be provided for every aspect of patient need, which includes those which are physical, psychological, social and spiritual. But most importantly, we work together as a team with our disciplines to provide safe and effective care. So a bit about the programme, which, as you can see, is comprised of a 50-50 split between theory and practice. Theory is delivered in a variety of ways, from lectures to workshops, as well as skills sessions. Some content is delivered online, and students are expected to engage in self-directed learning. Theory provides the knowledge needed to support clinical practice and is assessed by essays, examinations and presentations. Students practice in a variety of clinical placements under the supervision of a registered nurse. Their ability to demonstrate competence is assessed formally by a registered nurse assessor through a clinical portfolio. We are pleased to be offering our newly validated NMC programme from September 2020. As you can see, there are a variety of modules across the 3 years, some of which is shared with both mental health and children and young persons fields, which represent the holistic view of care I mentioned earlier. There are a range of assessments across the year, every year. Our students are always learning new skills, and this is undertaken in our state-of-the-art simulation suite. Students are given opportunity to practice in a safe environment under supervision of tutors and the opportunity to learn from each other. The global aspect of care is an important component of our course, and our students travel to placements all over the world. This provides an insight into the differences and challenges in health provision in other countries, but also an opportunity to engage in the wider cultures on offer. Some of my students travelled to Sri Lanka last year, where they visited clinics and worked alongside colleagues who still dress in the traditional cap and apron. They also got to visit temples and the elephant sanctuary. They found the experience enlightening and felt it had often changed their perceptions of healthcare and, indeed, how lucky we are providing healthcare in the UK. Closer to home, we are supported by our amazing practice partners in both NHS and private sector. These are just some of the large hospital sites, which include the University Hospital of Wales in Cardiff, as well as the new Grange Hospital in the Gwent Valleys, which is due to open in 2021. In addition, there are several smaller hospital settings as well as community placements. Here are some important details for you regarding applications. UCAS opens in September 2020, where you can apply for our spring intake, which actually starts in February 21, as well as September 21 and February 22. Shortlisting and interviews for early applications are completed in December 2020, with our core interviews taking place in February 21. It's important to be aware of the entry requirements from the typical A-level to access courses. Please note the GCSE requirements for English, Maths and Science require to be above a C grade. There are also a multitude of other appropriate combinations which provide academic credit, so please feel free to discuss this with us. For me, one of the most important elements in relation to your application is that of personal characteristics and core values, and needs to be clearly demonstrated in the personal statement. What is your motivation to study nursing? And how can you demonstrate that you have good communication skills? Do you have transferable skills that you have learnt in other jobs? We're looking specifically at things like integrity, trust. Do you have insight into your chosen profession? And so also the demands of the programme. Do you understand what nurses do and the demands of the role? It's hard work, but nevertheless rewarding. Be aware of your own personal self. Reflection being a core element of every registered nurse's toolkit. It's a skill we will help you develop over the 3 years. So how can you prepare yourself to create a personal statement which will make you stand out? There is a lot of credible online information which can inform you, but obvious choices are to be able to demonstrate your understanding of the 6 C's and how they apply. In addition, the Royal College of Nursing has published its Principles of Nursing, which brings the core values to life. As far as books are concerned, the list is endless, and our students will tell you, don't buy books until you start. We have an extensive library and they can be very expensive. The most obvious website to visit is that of the Nursing and Midwifery Council, where you can view the code, which provides insight into what is expected of you of the nursing professional. There are 4 key areas, as you can see: the ability to prioritise people, practice effectively, preserve safety, and promote professionalism. This last slide shows a typical celebration of a past group of newly qualified nurses. They were in their last day on the course before graduation. I do hope you consider Cardiff and share the same success. Good luck with your applications.